All right, so today I'm going to test your visual acuity and eye muscles and vision and stuff. And so I'm Melissa. How can I address you?
I'm Claire.
Nice to meet you. Okay. So first I'm going to start with looking at your eyes, eyelids, and eyebrows. Start with your eyebrows, making sure they're symmetrical, looking at the lateral 1/3 of it, seeing if there's any thinning. Then looking at your eyelashes, looking that they aren't curved in, that they're equally distributed and look symmetrical, which they do. Then looking at your eyes, seeing like normal blinking, looking at your sclera, that type of thing, just making sure everything kind of looks symmetrical, which it does. Then we'll move to looking at the conjunctiva and the sclera. So I'll have you look straight up, and then I'm just going to depress your lid here and shine a little light on the bottom. Looking that the conjunctiva looks nice and pink, which it does. And then I'm going to same on this side, and that looks good too. Then I'll have you look, while looking like straight up, I'm just going to depress your lids here. I'm just going to look at the sclera, which looks nice and white, no inflammation. And then as well as looking at the cornea and lens, so I'm just going to shine like a little light, making sure there's no opacities and which could indicate cataracts or glaucoma. Next I'm going to do the lacrimal, or assess the lacrimal gland. So you're just going to feel me palpate right next to your eye there, looking for any exudate or any blockage. You let me know if it feels any pain. Pain? Okay. Any pain on that side? Perfect, and nothing came out, so that looks good. Next we'll move on to the Perla test, so looking at your pupils that are to make sure your pupils are equal, round, and reactive to light and accommodate. So we'll start by inspecting the pupils, looking at that they're equal size, which they are, and round. Then I'm going to place a hand to block, and I'm just going to shine a light obliquely at it, looking at the pupil constricts, which they do. And then we'll use, so that was using an indirect light, and then I'll use a more direct light. Good. And then we're looking at if the pupils will accommodate to far in your vision. So I'll have you look at the pen and then switch to looking at the wall behind you, and then look back at the pen, bring it closer. Good, which they accommodate good, so that's good. Next we'll check the corneal light reflex, so I'm just going to shine this right on your forehead here, and so just looking that the light is reflecting in the same spot of the eye, which it does. Next we'll do an age pattern test, so looking for checking the muscles of the eyes and looking for any lid lag or nystagmus. So I'll have you follow the pen light, or follow my pen here. In the side. Yeah, making sure not to have the patient not move their head, just follow it with their eyes. Good. Down. Good. And then follow it in. Perfect. Good. And that looks all good. No nystagmus or anything like that. Next, I'll have the patient, so we'll do the cover and cover test, so looking at the eye alignment and muscle balance. So I'll have you cover one of your eyes and have you look at the pen. And then I'm just observing any movement of the uncovered eye. Okay, go ahead and cover the other eye. Good, and go ahead and uncover. Good. All right, and then, so next I'm going to check your peripheral vision, so cranial nerve 3, 5, and 6. So I'm just going to stand behind you. I'm going to come around with my fingers. Just raise your hand as soon as you see them, okay? So we'll start with the supralateral. So I'm going to start with the patient up here. Good. Then we'll come at the lateral and then infralateral. also look with the ophthalmoscope. So have the patient seated, and then I'm gonna come 15 degrees to lateral to the nose, the patient's eye, looking for the red reflex, and then following it in to find, see the retina, optic disc, optic cup. That. I'm just going to place my hand on the patient's head, looking for that red reflex, and following it in. Okay. And going on the other side. Which all looks good. Pencils look healthy, everything like that. All right, then we'll finish with the visual acuity test. So usually we'd be using a Snelling chart, have the patient stand 20 feet away, and then read the lowest line that they can. But we'll be using the Welch Allyn one, and it will keep it, or we'll have it 14 inches from the patient's face. And I'll have the patient cover one eye with the paper there and read the smallest line that they can.
Let's see. 6, 8, 3, 2, 7, 9.
Okay, what about the next one?
3, 7, 2, 5, 4, 6. Maybe.
Good, missed one, that was good. So it's 20/20 vision on that side, so now how do you do the other side?
6, 8, 3, 2, 7, 9.
Okay.
And then 3, 7, 2, 6, 4, 6.
Mm-hmm. Good, good. So 20/20 vision on each side. So her vision looks good.